And I just wish people could hear it, that if you're worried about side effects from the vaccine itself, your risks of what can happen to you or your loved one if you do not get vaccinated are astronomically higher.
We begin tonight at 5 o'clock with a very important story and a rare look inside the medical intensive care unit at Oregon's largest hospital. Like many hospitals in Oregon, OHSU has been overwhelmed by COVID patients. This story is part of our series looking at the front lines of healthcare during this latest COVID surge.
This week, Christine Pitawanich went inside the ICU to see how COVID is taking a massive toll on both patients and the people dedicated to caring for them. Here's what she saw. And a warning, the subject matter is graphic, including discussion of death. It may not be suitable for everyone to watch.
There's always a nurse kind of right here, ready to intervene at any moment.
The life of a nurse in OHSU's medical intensive care unit is exhausting.
So we're constantly assessing heart rate, blood pressure, oxygen levels. We're monitoring the waveforms on the ventilator to...
ICU charge nurse Erin Bonai showed us the reality that healthcare workers are facing. An ICU full of COVID patients. They lay motionless in hospital beds, hooked up to machines that are keeping them alive. These are the sickest of the sickest patients.
Every single patient on this unit right now has a breathing tube.
It's a scene people outside of the medical field don't often see, but it's happening in hospitals all over Oregon, says ICU nurse Julie Cleese.
We don't have any space in our unit physically to put a patient.
People from all over the Pacific Seaboard come here to OHSU to get medical treatment, from Alaska to Idaho to Montana, and not to mention the rural hospitals that rely on the doctors here and their expertise. This is the go-to place for serious medical conditions.
Our physicians are just being called at every opportunity. Can you take this patient? Can you help us consult on this patient? This patient is 26 and dying. This patient is 21 and dying. This patient is a father of 4 and dying. You know, can you help us? Our rural partners are struggling. They're at the limit of their capabilities, and that's when they turn to us, and the inn is full.
Nurses are taking on extra shifts and working themselves into the ground, all to help their patients, almost all of whom chose not to get the vaccine. While we were there, only one patient out of 14 had been vaccinated.
I don't think people have an inkling of the amount of suffering that you will experience being sick with COVID. It is extremely painful. Being critically ill is a very traumatizing experience. It is confusing, it's scary, you're alone with strangers, you don't recognize their voices. You lose your free will being in the hospital.
That suffering isn't just limited to the people in these hospital beds. It extends to their family.
If they get to see you, whether it's on a video camera or in person, they will see you suffer greatly. And it's really unnecessary. I mean, it's totally avoidable. I think that's the most heartbreaking part of it.
Because it's too risky to have family members visit COVID-19 patients in their time of death, they're often alone, save for a nurse at their bedside who becomes their family in that moment. It's a near impossible and heart-wrenching task.
What can you say? I know the depth of grief that I would feel if I couldn't be with my loved one as they died. So I take the responsibility very seriously to love that person as if they were my own family member, and provide them with a death that's dignified and honorable as much as possible in an ICU that is sterile and cold and unforgiving.
Down the hall, photos line the wall. We've blurred their faces for privacy, but the people in them are smiling. They look like family members. The man in many of them is smiling broadly. He's now nearly unresponsive in a hospital bed.
And I just wish people could hear it, that if you're worried about side effects from the vaccine itself, your risks of what can happen to you or your loved one if you do not get vaccinated are astronomically higher.
And the frustration around people who refuse to get the vaccine keeps growing.
You know, I had to call over to the pediatric ICU one day and ask for a Beanie Baby to give to a 12-year-old while I turned off the support and her dad died. Like, I don't want to do that.
ICU nurse Emily Williams has seen a lot. She's cared for people after a mass shooting, but she says this is another level, with people staying in the ICU for weeks or months. If this continues, other people who need medical help won't be getting it.
It kind of feels like the world just gaslighting you, like they don't believe your experience.
You see these people, you know it's preventable.
Yeah.
What goes through your mind?
It's devastating. It's really heartbreaking knowing that people are fighting for their lives, and it could have been prevented.
At the end of her day, Bonai, like many of her colleagues, doesn't have much more to give.
Often exhausted and defeated and sad, if I'm honest.
Americans who hesitate to get the vaccine, asking our nurses and doctors to shoulder the unbelievable weight of deaths and illnesses that are preventable.
This doesn't have to happen to anybody anymore. If you're able to get the vaccine, get it.
The healthcare workers here are nothing short of amazing. But yeah, that is the message that we've heard over and over again, that ending up in an ICU like this or worse, it's preventable through vaccination. Christine Pitawanich, KGW News.
And this is just one of the stories that we're going to feature in our series, Overwhelmed, Inside Oregon's ICUs. You can find previous ones at kgw.com right now, including one we aired last night from Pat Dorse, and look for more on our air next week.
One of the other hospitals we're featuring in the series is St. Charles Medical Center in Bend. Today, 150 Oregon National Guard members arrived to try to help the overwhelmed hospital system. They'll serve in non-clinical support roles that don't require a license. The jobs include screening patients and visitors, stocking supplies, and serving food.
We'll be facilitating a number of roles within the hospitals in order to allow them to focus providers on patient care and to increase their capacity to deal with the surge that they're facing.
Governor Brown has deployed almost 1,500 National Guard members to help hospitals across the state. FEMA is also sending support paramedics.
And take a look at this. Peace Health Southwest in Vancouver has had to put up an emergency tent because of all the patients that they are dealing with there. It'll serve as an overflow waiting area for people who need care. Hospital officials urge people to get vaccinated and to also consider an urgent care center for minor medical issues. Emergency care, though, at the hospital is, of course, available for life-threatening situations. The COVID crisis is also weighing down staff at Mercy Medical in Roseburg. Officials say a COVID patient died in the emergency room waiting room for an ICU bed. The patient didn't get a bed because they were all taken by other COVID patients. The hospital already expanded its ICU to try and avoid situations just like this one. Officials say the loss was tough for Mercy healthcare workers and the community.
Just into the newsroom, the University of Oregon and Oregon State University have both announced a new vaccine requirement. Those 12 and older will need to have proof of vaccination or a recent negative COVID test to attend university events and activities. That includes sporting events like football. Both new policies begin on Monday, this coming Monday, August 23rd. This week, both Oregon and Washington issued vaccine mandates for certain workers, such as teachers or those in the healthcare field. One question we're getting a lot is, what if someone quits or is fired for refusing to get the vaccine? Can they still get unemployment benefits? We reached out to the employment departments in both Oregon and Washington, and they told us this issue will be handled on a case-by-case basis. Important factors include what kind of accommodations their employer was willing to make and if the employee was eligible for a vaccine exemption. But generally speaking, If an employee doesn't have a valid exemption, their unemployment claim would most likely be denied.
The largest district in the state is requiring the COVID vaccine. So today, Portland Public Schools started clinics to get students and staff the shots before school starts. Here's Christelle Kumwe.
This clinic at Franklin High School is the first of several aimed at getting Portland teachers and other staff the COVID vaccine before school starts September 1st.
I feel good. I know that, I'm protected now.
Megan Hosek got her second dose Friday. She works in the cafeteria at Maryville Elementary. Hosek had already decided to get vaccinated before Governor Brown announced a vaccine mandate. It requires the shot for all staff and volunteers at K through 12 schools.
I guess it makes sense. It definitely easier to just get the shot than, have to take a COVID test once a week or whatever to make sure you're negative.
Marlena Bourgeois is also in favor of the mandate.
I think, look, we got to do what we got to do to make things right.
Her daughter is a student at Franklin High School.
I think we should all be vaccinated, but that's my opinion. I think it just makes a better environment for everybody.
The district is requiring PPS employees to submit proof of vaccination by the end of the month. Students 12 and older can get a vaccine at one of the clinics, but are not required to by the mandate.
I'm protected now, and, we have to wear masks, and I think every school, has a plan, so I feel confident and safe about going back to work.
The vaccine clinic happening here at Franklin High School is one of many clinics that will be happening through the end of the month at different high schools in the Portland Public School District. We'll have more information on when and where those will be happening on our website at kgw.com. In Southeast Portland, I'm Christelle Kumwe for KGW News.